Hey, I'm Dr. Millie's avatar, and this is her dog, Peanut Buster Parfait. He's a real dog, but this is his avatar. Keep tuning into these videos, and one day the real pup will appear. In the meantime, let's get started. I've been tasked to help you defeat nutritional deficiencies for a healthier you. When it comes to our health and well-being, there's one crucial aspect that often gets overlooked: nutritional deficiencies. These deficiencies can have a significant impact on our energy levels, mood, and overall quality of life. But the good news is that by addressing these deficiencies, we can unlock a healthier, happier us. In this video, we'll explore the common signs and symptoms of nutrient deficiencies and provide you with actionable tips and strategies to defeat them. The reasons behind these deficiencies are complex and varied. Some may be due to a lack of essential nutrients in our diet, while others may be caused by underlying health conditions, genetics, lifestyle, competition with medications, or even other supplements. For instance, people with celiac disease or Crohn's disease may struggle to absorb nutrients from food, leading to deficiencies. Similarly, certain medications like antacids and proton pump inhibitors can interfere with nutrient absorption. Understanding the causes of these deficiencies is crucial in identifying the right solutions. Identifying nutritional deficiencies requires a combination of awareness, self-reflection, and professional guidance. One of the first steps is to recognize the symptoms. Are you constantly tired despite getting enough sleep? Do you struggle with mood swings or brain fog? These could be signs of a nutritional deficiency. Another crucial step is to get regular blood or urine tests to identify any underlying deficiencies. Some of these may be available through your doctor, but in other cases, more specific functional testing may be required. Testing can't show everything, and sometimes a person with a normal lab value may still need the nutrient. The science of nutritional biochemistry is not perfect, and everyone is an individual. Keep that in mind. You are a unique individual. In any case, a knowledgeable healthcare professional knows what I'm talking about and can help you interpret the results and create a personalized plan to address any issues. Dietary assessments are also a good tool in identifying nutritional deficiencies. By analyzing your eating habits and lifestyle, a healthcare professional can pinpoint areas where you may be falling short on essential nutrients. This information can then be used to create a tailored plan to address the deficiencies. Additionally, keeping a food diary or using an app to track your nutrient intake can help you identify patterns and make informed changes to your diet. When it comes to overcoming nutritional deficiencies, there's no one-size-fits-all solution. However, there are some effective strategies that can make a significant difference. For starters, making dietary changes can help bridge the nutrient gap. This might involve incorporating more leafy greens, fatty fish, or whole grains into your diet. Supplementation can also be effective. Another crucial aspect of overcoming nutritional deficiencies is seeking guidance from healthcare professionals. Depending on their level of expertise and practice, they can help you identify the underlying causes of your deficiencies and create a personalized plan to address them. This might involve working with a functional nutrition coach or a registered dietitian to develop a customized meal plan, or consulting with a naturopathic or functional medicine doctor to identify underlying health conditions. Whatever the approach, it's essential to be proactive and take control of your health. From iron and vitamin D to omega-3 and probiotics, let's dive into the essential nutrients your body needs to thrive and more. Get ready to identify some causes of fatigue, brain fog, and low energy, and say hello to a vibrant, energetic you. Do you have your pen and paper ready? Just kidding. The beauty of YouTube is that you can revisit this video as often as you like. If you want a break though, go ahead now. I'll wait. Tee-hee. Nutritional deficiencies are more common than you might think, and they can affect anyone regardless of age or lifestyle. While diet is a big factor, sometimes it's unrelated. Some individual factors that increase the risk of nutritional deficiency include being underweight or obese, not taking dietary supplements, being on several medications, eating an inadequate diet, being dehydrated, being chronically ill, and overexercising. Here are the 8 most common essential nutrient deficiencies and their symptoms of deficiency. If these symptoms sound like you might want to investigate if you are eating enough sources of these foods or supplementing. You can always book a call to find out or talk to your healthcare provider. I'm also giving you with a few examples of some common medications that can deplete them. Keep in mind there may be other medications that deplete the nutrients listed here. But if you are on one or some of these medications and you are experiencing the symptoms, then it would be a great idea to address this with an experienced healthcare provider. 1. Vitamin D, symptoms of deficiency, fatigue, muscle weakness, bone pain, increased risk of fractures and having fractures, and mood changes like depression. Medications that deplete it, glucocorticoids, for example, prednisone, anti-epileptic drugs like phenytoin and carbamazepine, weight loss drugs that reduce fat absorption, for example, orlistat. 2. Magnesium. It's estimated that up to 80% of Americans don't get enough magnesium in their diet, leading to symptoms of deficiency like muscle cramps, fatigue, irregular heartbeat, mental confusion, and many, many more. I read an interesting study once that showed that people are more likely to survive a heart attack if they have sufficient magnesium in their system, because magnesium helps to relax the heart, while calcium contracts it. During a heart attack, God forbid, I would want my heart and vessels relaxed. Medications that deplete it, diuretics, such as furosemide and hydrochlorothiazide. You might notice that some medications that deplete magnesium are used to treat heart disease, creating a dangerous catch-22. Back to the list, proton pump inhibitors such as omeprazole, certain antibiotics, for instance gentamicin. 3. Iron, symptoms of deficiency, fatigue, pale skin, weakness, cold intolerance, and shortness of breath. Medications that deplete it, NSAIDs like ibuprofen and aspirin, proton pump inhibitors, for example, esomeprazole and pantoprazole. Note, iron is a nutrient that some people take too much of. In deciding to take iron as a supplement or medication, an entire iron panel ought to be performed. Hemoglobin is not enough. You want to know your red blood cell iron level, as well as your stored iron level, called ferritin. Let's flip the script on iron, because not only do medications deplete iron, but iron can interfere with the body's ability to make use of some medications. Yet another reason to check with your doctor to make sure it's okay to start supplementing. 4. Vitamin B12, symptoms of deficiency, fatigue, nerve problems like tingling or numbness in hands, feet, memory issues, shortness of breath, and anemia. Medications that deplete it, metformin for diabetes, proton pump inhibitors such as lansoprazole for high stomach acid for GERD or reflux. 5. Calcium, symptoms of deficiency, muscle spasms, brittle nails, osteoporosis, and abnormal heart rhythms. Medications that deplete it, corticosteroids like prednisone, and loop diuretics like furosemide. Note, calcium is a nutrient that some people take too much of in supplement form. Not only can too much calcium increase risk of heart and artery disease, it can also affect how the body absorbs other minerals like iron, zinc, and magnesium. Taking calcium and iron supplements at the same time can make it harder to absorb iron. It can also cause constipation and abdominal pain, so be careful what supplements you mix together, especially when taking higher doses. Side note, calcium on its own is not enough to support bone density. Bone density requires hormones and many minerals and nutrients like vitamin D and K2, as well as walking or jumping regularly. 6. Potassium is a very important mineral that we don't talk about enough. Symptoms of deficiency, weakness, fatigue, muscle cramps, and irregular heartbeat. Medications that deplete it, diuretics, for example, hydrochlorothiazide and furosemide, and laxatives with long-term use. 7. Folate, also known as folic acid or vitamin B9. Symptoms of deficiency, fatigue, irritability, anemia, and birth defects in pregnancy. Medications that deplete it, methotrexate for cancer or autoimmune conditions. Anticonvulsants, such as phenytoin. 8. Zinc symptoms of deficiency: impaired wound healing, hair loss, cracks at corners of the mouth, weakened immunity, and taste smell changes. Medications that deplete it: ACE inhibitors, for instance, lisinopril depletes zinc. Diuretics, like hydrochlorothiazide. Those are our top 8. I hope you enjoyed the information and found it informative. I decided to add a couple more as well. Although they are not as common statistically speaking, these 2 nutrients are not included enough in our diets. Usually we have to focus on them in order to get enough of them. They are 2 very important nutrients that contribute to vibrant health, so let's no forget them. Number 9 is omega-3 fatty acids. Some people call them fish oils. Symptoms of deficiency: dry skin, fatigue, mood swings, cognitive decline, joint discomfort, and poor cardiovascular health. Not directly depleted by medications, but a high omega-6 and trans fat intake from processed foods like vegetable oil, soy and corn oil, vegetable shortening, and deep-fried foods can reduce the balance of omega-3 in the body. Sources: fatty fish, salmon, mackerel, sardines, anchovies, and black cod, walnuts, chia seeds, and flax seeds. Lastly, this is one of my favorite nutrients. It often gets left off the list. It can become toxic if taken too much. Unless you're already taking it as a supplement or taking Accutane, you'd have to be eating fish liver or shark liver, taking excessive cod liver oil in order for that to happen. You might need to be living in the Arctic for this to happen accidentally. So as long as this is not you, let's focus on getting enough of it. Have you guessed it? I'm talking about vitamin A. Vitamin A's symptoms of deficiency are night blindness, dry eyes, increased infections, skin issues, and delayed wound healing. Medications that deplete it: Orlistat, a weight loss drug that reduces fat absorption, impacting vitamin A uptake. Mineral oil laxatives can interfere with fat-soluble vitamin absorption. Again, you should not take vitamin A supplements while on Accutane, isotretinoin, as both are forms of vitamin A. Sources: liver, carrots, sweet potatoes, spinach, and fortified dairy products. Note: pairs great with vitamin D because they are both fat-soluble. By incorporating these nutrients into your diet and addressing factors that may deplete them, you can support energy levels, immunity, and overall health. Always consult a healthcare provider for personalized guidance. In conclusion, nutritional deficiencies are a pressing issue that can have far-reaching consequences for our health and well-being. By being proactive, recognizing the signs and symptoms, seeking professional guidance, and understand our medication side effects, we can overcome these deficiencies and unlock a healthier, happier us. Thanks for watching, and don't forget to share your own experiences with nutritional deficiencies in the comments below. If you're looking for more health tips and advice, be sure to check out my other videos and subscribe for regular updates. Give Peanut Buster some love.